Hey guys, so I want to start off this week with something a little bit different. So before I get started, today's video is going to be on EFT tapping for ADHD, which is attention deficit disorder. I want to give you a little bit of a pre-log or a neuroscience, neuropsychiatry background on ADHD before we get started with the tapping. Now, this tapping is great for children. It's good for adults that suffer from ADHD. What I'm starting to realize is that most of us actually kind of function with a little bit of ADHD at some point or another. Now, I look at everything kind of like a spectrum, right? There's a spectrum of starting out with something, and then there's like the full-blown condition that people are dealing with. You could be somewhere on the spectrum, but this EFT tapping is going to be great for anybody who experiences fatigue, hyperactivity, impulsivity, perfectionism, anything that goes along with the ADHD diagnosis. So before we get started, I want to talk about Gabor Mate's work, and I'm going to show you his book here. So Scattered Minds is a must read. It's absolutely amazing. It's great for clarifying any questions that you have if you're dealing with ADHD. Now, it's also a very different kind of perspective because he is actually a neuropsychiatrist. So he looks at the trauma-related aspects of the condition. ADHD medically is not seen as necessarily a trauma condition, but Gabor Mate found some really interesting links between childhood and the development of ADHD. We're going to be talking a lot about this on my channel, Theta Coaching. Stay tuned. We're also developing our website, so you're going to be able to take a look there. If you haven't already, follow us on Instagram. It's _Theta Coaching. We do a lot of information about brain training, prefrontal cortex work, anything that you can really do to kind of strengthen your brain. So follow us there. Back to Gabor Mate's work. So the trauma linked to ADHD is very important for both parents and patients. So if you're a parent of a child who has ADHD, or you're a patient who has been diagnosed with ADHD, I personally found it very beneficial to understand where things were developing from. And of course, this isn't going to be always the case. There's a very physical element, and then there's a very mental emotional element. And that mental emotional element actually can be traced back to many scenarios that happen between the parent and the child when they're early developing. Now, society has a lot of norms when it comes to breastfeeding, when it comes to how you respond to your children and how to discipline your children appropriately. What's interesting about Gabor Mate's work is it's a lot around what you're signaling the child and then in turn creating neurologically in the brain of the child when you do certain things. The brain essentially is this big coordinated network, right? It's an organ. And what happens is when we have different experiences in life, we create these neural networks in the brain. You've probably heard what things that fire together wire together. Essentially what that means is that different neural networks will fire according to certain experiences. So if you have an experience where essentially you feel very anxious and you feel very embarrassed or shameful in a certain context, this could be in school, for instance, with social anxiety, the more that you come into play in a scenario that is similar to the one where you experience that, you almost create a re-traumatization or a activation of those neural networks that fired together. Now, the problem with that is that you start compounding over the lifetime. So what was once not a big deal starts compounding, and reinforcing more neural networks that create that experience, which is that hyperactivity and that nervous feeling in social anxiety. For hyperactivity in terms of ADHD, that could be your lack of concentration, your lack of focus, your squirrel brain, as well as your people-pleasing mannerisms. So these origins are very, very interesting. I can go on, I can actually do a video separately on these origins if you're interested. If you are, leave a note in the comments, let me know what you want me to talk about, and I will do that there. But enough said, let's get on to our EFT for today.
I give my life, I give it all, for a look, for a call, for a kiss, for a roll, a part of any universe, of any planet and the sky, brought in motion by your light, you're a star in the night, you keep me up when you say.
So as always, I want you to sit up for your EFT. Karate chop position. My feet are grounded into the earth. Okay. I love and accept myself. I love and accept myself and anybody else involved. The trauma I am feeling the hyperactivity in my brain that causes me to lose focus and skip from task to task is an activated neural network, an underlying trauma or belief that I have programmed in my body to be true. And I'm ready to work on that neural network. I'm ready to heal it. I'm ready to reprogram it. And allow those feelings of shame, of guilt and fear to leave my body and my mind and my spirit. So that I can feel peace. So that I can feel calm and clear. And so that I can feel grounded. I am grounded in myself. I'm grounded in my environment. I feel safe. I am safe. I am cared for. I'm supported. I'm worthy of love, time, and affection. And any signals that claim otherwise are not true. They're false. I don't need them anymore. I don't need that feeling anymore. So I'm going to release it. I'm ready to release it now. Mind, body, and spirit. Take a deep breath. Let out that anxious energy. And hopefully, as you do, as I do, feel more grounded in your body and less hyperactive. Love and light.